are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. Today I'd like to talk about the importance of examination and how this can help your physician, or me if I'm your physician, checking to see the signs of hormone deficiency. As I've noted before, most doctors have realized that patients really don't like to come in for examinations, particularly for pap smears and gynecological exams. Today, I'd like to explain why this exam is especially important in perimenopause and menopausal women. Perimenopause is a time when women still have estrogen production, but it can be irregular. This results not only in irregular cycles, but sometimes in tissue insufficiency. The urogenital area in women is absolutely loaded with estrogen receptors. If estrogen levels drop enough to result in tissue insufficiency, you can see it on an examination. Let me give an example. Unhealthy genital tissue in women results in dry, constricted tissue. If it's severe, a pap smear or placement of a vaginal speculum will be painful, and this should be deferred until after the woman is treated. No woman should be, unless there is something horribly urgent, for a routine pap smear should be put in this painful a situation. If the patient has healthy, moist, and we talk about it as elastic tissue, we can advise the patient that everything looks great. They usually like to hear this. If not, we know that we should start treatment so that everything does look good, not only looks good, but is functioning well. We cannot see the bladder, but the urethra can develop carbuncles or growths around it, which can be painful. These growths usually occur when the patient has insufficient estrogen and is a marker of deficiency. Again, this should be treated. Many women do not realize the connection existing between the bladder and urethra and vagina. All these tissues are loaded with estrogen receptors. Any insufficiency can cause all kinds of problems. One of the most worrisome is a bladder infection. This is very common, and those of you who have experienced this in their younger years will likely remember how painful it was until treated. The danger of an untreated infection can spread to the kidneys and cause damage. The strange part of menopause is that the receptors in the bladder may not hear the bladder infection as well as in younger years. The older patient may not realize that she has a bladder infection, and this is very, very common. Years ago, a presenting doctor at a conference, a medical conference I attended, advised the audience, don't even test older women for urinary tract infections because, quote, they all have them and it will come out positive. I could hardly believe any doctor was standing up and saying this. but they were just shrugging off, don't even bother to look, because don't treat them. They'll all just have it. Let's, it was just unreal. So I don't have that attitude, and I don't think doctors today have that attitude. I hope not. The real story is that urinary tract infections can exist and frequently do in menopausal patients. Patients often don't recognize them. The symptoms they have may be very subtle. For instance, they may note fatigue or difficulty with cognition. I've had patients complaining that they're having difficulty with their memory, worried that they are losing their mind or developing Alzheimer's disease, and it turned out that they had a urinary tract infection. When that was treated, these symptoms cleared up. I always include a urine analysis in menopausal patients when they're getting their checkup lab work done. I found many patients that are positive, that are having a roaring urinary tract infection, have no clue. So this is something to be very careful of. And I want to also mention that it's not a bad idea for women, especially if they've been found to have a urinary tract infection that they did not recognize, to go to the drugstore, buy some urinary test kits. You can do this at home. It's very easy. Dip the little stick in a glass of urine, hopefully a clean glass, and it will tell if there's bacteria there or not. And I encourage women to do this on their own, just to make sure this does not recur. Another important fact to note is that there are signs of tissue changes in menopause due to estrogen deficiency. These changes may be occurring in the muscles of the pelvic sling. Now, what can this do? Well, these muscles are what supports your bladder and prevents you from having urinary leakage. Urinary leakage is a common problem that women are unfortunately having to deal with as they get into menopause. This can be helped tremendously by supplying estrogen and sometimes a little testosterone to these tissues. You'll have stronger muscles and won't have to worry about urinary leakage. Nobody wants to deal with that. And by the way, Kegel exercises also very good as any exercise to strengthen the pelvic muscles. Long-term deficiency of estrogen and testosterone results in dry, non-elastic type tissue that can make sex difficult and painful. All menopause patients deserve to be offered therapy, even if they are a breast cancer patient. My favorite approach to treating patients with breast cancer, because we worry about estrogen getting in their system and stimulating estrogen receptor positive breast cancer, is to prescribe DHEA, which is now available in suppositories for women, the vaginal suppositories. In this case, it's very interesting that the cells in the vaginal area and around the urethral tract can take DHEA and turn it into either estrogen or testosterone, whatever that cell needs within that cell. So they're not having estrogen or testosterone go all throughout the body, which would be okay with most women, but estrogen positive breast cancer patients, you want to minimize this as much as possible. This product is called progesterone. And it's been out there for several years, not used a lot, but certainly available, and it has the studies behind it to show how effective it is. Thanks for listening today, and I'm going to do a few more tidbits about this particular area, and so stay tuned, and thanks for listening.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.